Hey guys, I'm back again with another science breakdown. So I'm going to try to do these more often, but let's see if I can actually commit to it. So the study that I went over today is like, it wasn't brief, like it had a lot of papers, but there's not a lot here. It's just basically a meta-analysis, and the title of the study was Effects of Hip Abductor Muscles Exercises on Pain and Function with Patients with Patellofemoral Pain, a Systematic Review and Meta-Analysis. And it's by Rogan et al. There's a lot of people here. So they started off with talking about what patellofemoral pain is. I know what it is because I've had it. It's basically like non-specific knee pain. It's knee pain that doesn't really appear to have a cause, even though pain has to have a cause, and that's something that Dr. Steve McGill talks about all the time. But it's basically like unexplainable knee pain, and it's also sometimes called runner's knee, anterior knee pain, whatever. Sometimes you feel it like behind the kneecap. Other times it kind of moves over to the side, more like a meniscus irritation, but it's still sometimes called patellofemoral syndrome. But as I have seen in the case of some really great physical therapists, they will actually say, hey, yeah, it's actually your meniscus. It's not some unexplainable pain. Anyway, all right, on to the actual stuff. So some of the causes of patellofemoral pain, it's claimed to be abnormal tracking of the patella, increased patellofemoral joint forces, or a combination of these biomechanical factors, blah, blah, blah. Okay, so I've actually read other research laundry lists of stuff that say that patellofemoral tracking, which is like your kneecap, the way that it tracks on your knee, sometimes people say that that's the reason that you get pain. I have heard that that's not the case at all, so I really don't believe that, but that is the commonly understood thing. That's one thing that people look at is your kneecap's not tracking correctly. They blame your vastus medialis oblique, or however you say that, your VMO. Sometimes they'll try to attack that muscle, make it stronger, and they think that's going to fix the patellofemoral tracking thingy. Anyways, but this study actually went above and beyond that, and this paper went above and beyond that and looked way past any of that old school stuff. The problem with the VMO thing, so the VMO is one of your quadriceps muscles, and sometimes they try to, in therapy, strengthen that muscle to try to fix the knee tracking. The reason that these guys were saying that that's not really a good method is because, I'll just read it. The knee joint is located between the hip and the foot and must always adapt to biomechanical stress and kinematic deviations. So because it's always moving, because the function of the muscles is changing depending on the position of the leg and the knee in relationship to the hip and to the lower part of the body, you can't say that it's just this one tiny muscle connected to the knee. It's got to be something bigger, and considering that the hip musculature is kind of controlling the entire leg as far as its like swing and gait and all that stuff, they're saying it's got to be in the hip. So that was very important, covering that first. All right, flipping through. This is just the studies that they looked at, how they decided which studies to look at, blah, 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 blah. Okay, and then they talked about why people were included in some of the studies. Generally, they just have different criteria for pain. So different studies that they looked at in the meta-analysis had different criteria. Some of it was pain in this situation. That one, like one in particular was they had pain ascending or descending stairs, squatting, kneeling, jumping, prolonged pain with sitting, or pain whenever they touch the patellar ligament. Totally different thing. Talking about the ligament pain or like tendon pain. Anyway, this stuff gets crazy, right? Knees are a little bit complicated, but sometimes I think we make it harder than it is. Trying to slow down. Okay, so they got down to the meat of it, and they started to find some trends with their studies. So some of the big studies were, let's see, the first one says effect of hip muscle strengthening versus no hip muscle strengthening. So there were some studies that looked at primarily strengthening the hip muscles versus not strengthening the hip muscles. So they didn't really do anything in this control group, and then in this other group they did hip strengthening, and they were doing like abduction and external rotation stuff with the hips, and I'll talk about that in a second. What they found is that the hip training group had a reduction in pain. Duly noted. All right, so the next one was the effect of combined hip plus knee muscle strengthening versus knee strengthening only. So hip plus knee strength versus only knee strength, and they found that the combined hip plus knee strengthening reduced pain in the people with knee pain, those people. Okay, weird thing, every time I read these research papers and I see the like exercise lists and protocols that they give their not clients, their subjects, I'm like, do you even lift? Because no one does those exercises. Not saying that every exercise is bad, but anyway, sometimes it's like, that doesn't really do anything. You should give them something harder. I will say that the majority of the people that were used in these studies were non-athletes, or they were female. There was only like 13 males in all of the studies they looked at. So primarily women, primarily non-athletic. So that does give you an idea that maybe that's the reason they chose the exercises they did. I don't know. I feel like sometimes therapy is too soft, but whatever. So let's see here. So what they found is a positive effect of hip muscle strengthening on pain. So basically, if you're strengthening the hip, the pain seems to diminish. But they also were saying that if you do hip plus knee muscle strengthening, it helps to improve the function. So now not only are you improving the pain sensations, or are those decreasing, but you're also improving the function of the joint. So you're able to use it through full ranges of motion in case that was being diminished. They're getting more strength back. So all of that stuff is important. Let's see. So yeah, hip strengthening exercise may be more effective than just quadriceps strengthening. I think sometimes there's two different camps. Sometimes therapists and personal trainers, we get too focused on just one part of the body, and we want to just strengthen that one part because there's pain there. But there's other things that are involved. And then you have some people that are so like functional mindseted that they're like, oh, I have pain in my toe. That must be caused by my shoulder, or vice versa. Now, sometimes things do go through a chain, and sometimes those things do happen over time, but we do have to start from the closest thing and then work backwards and work outwards from that, work distally. So if you're starting with the quads, and the quads are part of it to help function, you do have to also move up to other areas that help: calf muscles, hip muscles, and those were observed in some of the studies. Anyway, so a couple interesting parts from these studies. One, it said, it has been reported that in contrast to men, functional impairment in women may not occur only because of pain, but also because of negative mood, psychosocial and psychological factors, and changes in the hormonal system. So they're saying that, if I'm understanding this correctly, it's saying that the functional impairment from the knee pain wasn't just like because they couldn't use their leg. It was because they had all these emotional things attached to this. And this is a huge like psychology part of being injured, is like everything changes, like you feel really bad, you get in a bad mood. And that was actually part of something that one of the studies was considering, is that sometimes this is a psychological thing. It's not just like they can't use their leg. The other interesting thing was 7 of the studies used open chain hip exercises, and only 3 studies used closed chain hip exercises. So open chain is where you're taking a joint and like moving it. So if I'm doing a pressing, horizontal pressing, open chain is I have the barbell in my hands and I'm pushing it, so that the distal part of my body is doing the moving. Closed chain means that the moving part is actually attached to a fixed surface. So if I'm doing horizontal pressing, a push-up would be a closed chain. Bench press is open chain. So like open, closed. Hopefully that makes sense. What they did mention though is that, I'm going to read this right out of the thing. It says, with functional training within the functional training concept, working with closed chain exercises is commonly preferred because such exercises are similar to normal activities and normal activities of daily life. So basically they're saying open chain exercises are not functional, so the other ones are more preferred. But what was funny is that both training methods decrease pain and improve functional status in persons with patellofemoral pain syndrome. So people who did the open chain exercises and the closed chain exercises both received benefits from the movement, because you're strengthening the frickin' muscles, okay? Doesn't matter if it doesn't look like everyday living. If you're still using the muscles, it still helps, okay? That's just a starting point. Doesn't mean you can't do both. This crap drives me insane. Anyway, get it together. All right, here we go. So they said that there was more research needed with a couple of different things, like Let's see, what do they say? Using closed chain versus open chain exercises, there should be measures of gluteus medius activity because that's one of the biggest muscles that's going to be used in those hip strengthening exercises. So like the smaller portion-ish of the glutes, and a bunch of other things, basically determining, are the hip strengthening exercises actually helping, or are we just pretending they're helping? They think that that should be studied more directly. And then, let's see, studies indicate that patients with patellofemoral pain have 30 to 36% less hip external rotator strength and 20 to 27% less hip abduction strength as compared with healthy individuals. So they're saying that these studies are saying people with knee pain generally have weaker hip abductors. Surprise! That's kind of what all of this is saying altogether. So essentially it's saying if you have knee pain, there's a pretty good chance that your hip abductors are weak. If you strengthen them, you're going to have decreased pain. If you also strengthen your quadriceps and muscles around the knee, you're going to have increased function. Ta-da! That's kind of the main takeaway. The only thing that they did say is because there weren't a lot of athletes that were studied in all of these studies, that you have to be careful when applying it to athletes because they have to cover their butts, but they're basically saying you should probably do this. So anyway, if you have some knee pain, that's just some ideas for you. Any kind of abduction exercise are going to be helpful. Maybe I'll make a video on that showing some abduction exercises, but essentially external rotation. So I think I did say I was going to do this earlier. Seated band hip abductions, where you're sitting, you have a band around your knees and you're pushing out. That kind of stuff works. Lying abductions, where you're laying on your side, lifting your leg. Those that's an open chain abduction exercise. Cable abductions, stuff like that. Sometimes hip airplanes do that kind of thing too. You can pretty much look up hip abduction exercises on YouTube or Google and you will find some, but I will make a video somewhere about that eventually. Anyway, hopefully that helps, and I'm not a doctor, so don't take my word for it, but I'm just saying the studies are showing strengthen your butt and your knees will feel better.